Today at Investigate TV Plus Weekend, research finds most ERs aren't fully prepared to treat children, raising concerns that thousands of young lives lost each year could have been saved.
This is 6 airplane loads of children dying unnecessarily.
Plus, a family says understaffing cost their loved one his life. We investigate the growing nursing shortage hitting hospitals nationwide.
To me, it means they didn't have enough nurses.
Investigate TV Plus Weekend starts right now. Hello and welcome to Investigate TV Plus Weekend. I'm Lee Zurich. For some families, the ER is a last resort and often a lifeline. But a new study found the majority of emergency departments in the U.S. are not fully prepared to meet the needs of pediatric patients. Our Heather Graff talks to the doctors behind this research and shows you why they say an affordable and life-saving solution already exists.
My daughter, Rebecca Ava, was born July 13, 2006. She was born healthy. She was beautiful.
When Phyllis Rabinowitz took her baby girl home from the hospital, she had no idea her family's joy would be fleeting.
Unfortunately, by the end of the day, we felt that she was having very alarming symptoms.
Symptoms that prompted a panicked trip to the emergency room.
She was not feeding well. She was not breathing well.
But Phyllis says doctors in the ER sent her daughter back home.
They thought it was a common cold.
And just a few days later,
it changed our lives forever.
Rebecca was gone.
At 9 days old. We called the ambulance and we rushed back to the emergency room, and there was nothing left to do because the virus that had taken over her body just moved that fast.
Phyllis says an autopsy later revealed Rebecca had died from a viral infection that went undiagnosed in the ER and therefore untreated.
We quickly learned that many emergency rooms aren't prepared for children. It's causing deaths.
Are children dying unnecessarily because of this?
The answer is yes.
It's a phenomenon Dr. Nathan Cooperman has been researching for years. He's the chief academic officer at Children's National Hospital in Washington, D.C. And while ERs in pediatric hospitals like this one are specially equipped to treat kids, he says that is not the norm in many community hospitals across the country. The National Pediatric Readiness Project evaluates ERs on criteria that include the availability of child-size equipment, along with pediatric-specific protocols and training. High pediatric readiness defined as scoring at least 88 out of 100 on that assessment.
I don't want parents to panic, but this is important.
Cooperman's latest study, in partnership with Dr. Craig Newgard of Oregon Health and Science University, analyzed data from nearly 5,000 emergency departments nationwide and found just 17% had that high level of readiness. In other words, 83% of those emergency rooms are not fully prepared to care for children.
Each year in the United States, about 8,000 children die after presenting to the emergency department. And our estimate is probably 25% of those deaths could be prevented if the hospital moved to the high readiness state.
So more than 2,000
More
children.
than 2,000 children per year, exactly.
Researchers also used predictive models to determine what it would take to bridge that gap. And this map illustrates what Cooperman considers to be eye-opening results. The estimated annual cost to reach universal high pediatric readiness ranges from just $0 to $12 per child, depending on the state, for a total of about $207 million each year to cover every ER in the U.S.
$200 million a year is what we would call budget dust. It's affordable. Very affordable.
To better understand how it's so affordable, he points to this checklist that provides critical but cost-effective ways to improve an ER's pediatric readiness score.
One of the most important things is what we call a PEC, P-E-C-C, a Pediatric Emergency Care Coordinator. That is, having somebody in every emergency department whose job is just to make sure that you have the protocols in place, you have all the equipment necessary. That is a very, very high return on investment.
And that caught your attention.
It did.
Tell me about that.
I'm glad this study came out to show us the gaps.
Dr. Steve English is medical director of the ER at Jamestown Regional Medical Center, about 100 miles outside Fargo, North Dakota. And in a rural area like this, he admits high pediatric readiness can be difficult to achieve.
Turnover is a big part of it. It's hard to recruit people to rural North Dakota.
Despite those challenges, the staff here recently began working to better prepare for their youngest patients. This color-coded pediatric cart, perhaps one of the simplest of the recommended changes.
We open a drawer and the specific equipment is there already.
They also convinced hospital administrators to invest in certain youth-specific supplies, and Dr. English himself is now trained as the Pediatric Emergency Care Coordinator. He says all of it helped raise the ER's pediatric readiness score by 14 points in just a matter of months.
Not where we want to be quite yet, but I think we're definitely better prepared.
A success story in North Dakota. And back in Washington, D.C., Dr. Cooperman hopes policymakers will also be compelled to take action.
I think the federal government or state governments do need to be involved. And this is a roadmap for legislators to say, hey, in your state, you can do this by investing this amount per year.
This is my memory box of my daughter, Rebecca.
Until then, Phyllis Rabinowitz says she'll keep sharing Rebecca's story.
I never got to know her. I never got to see her grow up. It's 18 years later, but I feel like it was yesterday.
18 years of grief and 18 years of advocacy. But after learning about this new research, she feels real change is finally within reach.
Let's do this. Let's do this now. We can.
The mother you heard from in this story founded a nonprofit called the Our Baby Foundation in honor of her daughter, Rebecca. The organization often provides grant money to help hospitals with training, and they're advocating for legislation that would federally mandate high pediatric readiness in ERs. Right now, Delaware is the only state where every emergency department meets that standard. Coming up, her son died alone in an ER bathroom. Now his case is raising new concerns about hospital staffing and a growing national nursing shortage. Across the country, the demand for nurses is rising, with federal data predicting we'll be facing a shortage of more than 200,000 registered nurses in roughly the next decade. Our Andy Perotti looks at how shortages are being blamed for lapses in patient care, including in a new lawsuit against a hospital accused of not doing enough to keep a patient alive. A warning to you, this story discusses suicide.
Savannah, Georgia police respond to a call inside an emergency room in 2024.
So he was like hanging, like his body was like this.
Do you know who initially made that call to security?
Inside this bathroom, a man found hanging from his hospital gown. His name, Michael Sheridan.
I was with him. I was holding him. I had said to the doctor,
Carol is Michael's mom.
I said, "Doctor, how could this happen?" And he said to me, "I don't know." He says, "I don't know."
Before he arrived at Memorial Health University Medical Center, he called 911 from this hotel, begging for help.
Channel 911, where's your emergency?
Hi, I'm having a nervous breakdown.
It happened when the 35-year-old New Yorker stopped in Savannah on his way to visit family in Florida. Diagnosed with bipolar disorder in his 20s, he recognized he was having a mental health crisis.
I'm having suicidal thoughts. I don't know what I'm doing. Please help me, please.
According to a pending lawsuit, when he arrived at the hospital, staff did not help Michael when he needed it the most, claiming they left him unsupervised when psychiatric patients are supposed to be monitored at all times. According to a police report, Michael was seen carrying multiple gowns into the ER bathroom, locking it from the inside. Security forced the break down to get inside.
I got there and I'm like, "How long's it been in there?" They said, "Like about 30 minutes. I'm like, "What?" I said, "Why are they just not calling us?"
Natalie Woodward is the family's attorney.
Did everything right. He did everything right. His mom did everything right. I mean, I think that's the tragedy of it.
The lawsuit claims when Michael went to the hospital, he should have been taken to a section of the ER reserved for psychiatric patients to wait for a mental health professional, but the ward was closed.
What was the reason for it being closed? You remember?
Staffing. And he was the only 13 that we had outside the department.
What does that mean to you?
To me, it means they didn't have enough nurses to operate that unit. This was something where it was just so preventable and easily preventable. This was literally just a matter of keeping eyes on him and making sure he doesn't hurt himself until the psychiatrist can get there to do what needed to be done next.
Memorial Hospital declined interview requests, but in a prepared statement wrote, "The loss of a loved one is devastating, and our thoughts remain with this patient's family and friends. We're aware of the filing, which we are reviewing, and we will respond through the legal process." While the hospital did not acknowledge if it experienced staffing issues the day Michael died, Georgia is among one of the top 10 states with the largest projected registered nurse shortages. According to the National Center for Health Workforce, these 10 states are on track to face shortages of RNs between 17 and 22% by 2037. The number of nurses that would be needed to fill the gap in these states, 194,000. Would you agree with that?
I would say that well-being challenges, resource challenges absolutely are still a concern.
Chelsea Agopian is executive director of the Georgia Nursing Workforce Center and an assistant clinical professor at Emory School of Nursing. So you may be surprised to hear she doesn't call Georgia's projected need for nurses a shortage.
So the problem with the rhetoric of the nursing shortage is it just ignores the complexities of nursing workforce challenges. So by just saying the nursing shortage, it doesn't give you enough information to define the problem correctly and then have good solutions.
Her organization, like many other state nursing workforce centers, is trying to figure out where Georgia's nurses are working or not working to focus resources to medical fields where nurses are needed the most. At the moment, the state doesn't track that information.
If you ask, say, a private practice in Atlanta, they might say, we have plenty of nurses, where we're getting plenty of applications, where we have all of our patients covered, all the nursing services needs are met. But if you're asking, say, a rural community hospital, they may give you an entirely different story.
I could tell that he was pretty anxious.
I'm having a nervous breakdown. I'm having a nervous breakdown. I need psychiatric help, please.
A young man crying out for help and a hospital accused of not having enough staff to keep him safe.
And I think if somebody said to me, think of your worst nightmare, I don't think I could have imagined anything worse than that.
The hospital and health system responded to the allegations in court in late June. They deny any negligence. If you or someone you know is struggling with thoughts of suicide, help is available. Call or text 988 or go to 988lifeline.org. Up next, thousands are rationing or skipping the meds they need. We investigate what's causing the shortages and a possible fix to strengthen the system. Right now, more than 250 medications are in short supply across the U.S., from common antibiotics to critical cancer drugs. It's the latest chapter in a decades-long fight to make generics more accessible and to build a drug supply that's reliable, not vulnerable to overseas production delays and red tape. Reporter David Amilati shows how one patient is forced to ration her meds and a solution experts say could stabilize the supply chain.
For St. Louis City resident Kristen Jacoby, staying on task isn't easy.
Feeling flustered and overwhelmed.
She's one of 15.5 million adults in the nation functioning with attention deficit hyperactivity disorder, or ADHD.
I just feel like I can't get a grasp on life or get a grasp on whatever I'm doing.
Amid a 2-year shortage of medication.
You were not able to take your medication today, correct?
Correct.
How is that impacting you right now?
Well, I'm pretty fidgety. I feel like my mind goes all over the place. It's really hard to sleep at night because my anxiety kind of keeps me up.
She takes a generic version of Adderall because it's covered by insurance, But to stretch her meds, she skips her daily dose on the weekends and days she doesn't go into work.
My brain needs it every day to function properly, but it's not something that I feel I can do at this point.
Kristen has been trying to get her script filled for almost 2 months. In her records with CVS, it shows her medication was last filled on August 12th and was last prescribed on September 9th. Since Adderall is a controlled substance, she has to reach out anytime meds need filled. Kristen has had a constant back and forth with her doctor to get insurance to move. In this email on October 7th, she says her prescription has been out of stock for over 30 days because of CVS's nationwide shortage and wants to send her script to a nearby Walgreens. She tells First Alert 4 her insurance provider says because she's over the age of 18, that's a problem approving the medication.
This isn't something I grow out of. I'm going to be dealing with this forever.
Who do you hold responsible for what you're experiencing?
The FDA or DEA, the people that are blocking the amount of drugs that these manufacturers can produce. The insurance companies make it really difficult, having to make people jump through hoops to get medication approved that they've already been approved.
Other parents across the metro having a similar experience with their child.
For people who have insurance that only covers generic, now to have to pay for the name brands out of pocket. Eventually those are going to run out too. You wonder how long this is going to go on before it does get fixed and who's going to help fix it.
We found the CDC says 71% of people have trouble finding the right medication right now. The reason why they can't get their drug is because the manufacturers aren't motivated to make the generics, and insurance companies won't cover brand name drugs, which is why people like Kristen haven't gotten their script in 2 months.
We started looking at, well, why is that the case? It's an economic issue. This is not a logistical issue.
WashU researcher Antonio Sardella says this comes down to a fragile supply chain. He tells me for the first time in history, the U.S. has a record 323 medicines on a shortage list.
Many of these medicines are not produced in the United States, so the system is very vulnerable and dependent on foreign suppliers, which could result in easily disruptions as those medicines try to make it to the U.S.
To better understand the impact of the shortage on our region, this local pharmacist agreed to speak with us on camera, but asked to be anonymous since his corporate employer did not give him permission to speak.
Why is it that you wanted to sit down and talk about what's happening?
We're a victim of the system.
He says the Federal Drug Enforcement Administration is to blame for this crisis because it did not enforce manufacturers make the required amount of drugs. According to the DEA, it regularly engages with manufacturers about their production of drugs and set limits, called quotas, for how much of these drugs can be produced. In an August 2023 letter from the DEA administrator, Ann Milgram, she says her agency discovered for amphetamine medications like Adderall, manufacturers did not produce their full amounts that these limits permitted them to make, resulting in a 1 billion dose shortfall for 2022 and a similar trend for 2023. As a result, the DEA instituted 4 changes to quotas and reporting to help see shortages coming and adjust more quickly. 14 months later, patients still struggle to find their medication.
I see these patients every day, and you see their face of desperation of like, oh my God, we another week without my medication, or another day, or God knows how long. And it's heartbreaking not being able to have a quick solution.
The fix could be here in St. Louis.
This is like the fridge.
Remember Tony with WashU? He's also the founder and chairman of the nonprofit, the API Innovation Center.
Right now, St. Louis is playing a leading role in building resiliency for the United States drug supply chain.
It's a local effort to replace the 92% of pharmaceutical medicines produced outside of the United States, making our supply so vulnerable.
The key is to not only produce it, produce higher quality, produce it at lower price, to produce it in a way that is more efficient.
Its first task is to produce 6 generics, including one for brain cancer. Sardella says they can produce a year's supply for the United States in just 2 weeks.
Is it fair to say we've lost lives because of this shortage in the country?
Absolutely. Bringing these medicines to bear is critical to survivability and also quality.
While WashU focuses on the economic impact of Sardella's program, the University of Missouri-St. Louis is handling the science research.
Go to these 3 lines right here and then eventually combine.
Here, medicines are made in small quantities to be increased for mass production. That won't start until next spring, when area manufacturers finish upgrading their facilities to house these advanced technologies.
Allows for great scalability. We can use it here in the research, but then move that equipment to production.
These chemists work on the Corning machine in Umsel to develop the medicines, But this modern tech changes the profile of the jobs needed for the local drug manufacturers, cutting down on the number of chemists on the assembly line with more quality assurance type jobs.
Now you're unlocking individuals who may not want to pursue careers of higher education, at least not initially, to enter into the space.
The API Innovation Center just received a first-of-its-kind $14 million grant from the Biden-Harris administration and the Department of Health and Human Services. He says API will now increase from 6 to 25 essential medicines and an almost $1.3 billion impact over the next 15 years in the St. Louis region. One of those new meds will be a generic for ADHD. But Sardella says that's 5 years away from getting to the hands of people like Kristen, who are left to juggle all their responsibilities, from doing the dishes to making calls to get their scripts filled in the meantime.
It's not like it's a life or death issue. This isn't a medication I need to survive per se physically, but for my mental state, it's so important.
After the break, scammers are banking on your digital footprint. We show you how to shut the door before they walk through it. With every swipe, click, and scroll, you'll leave a digital trail, and that trail could be exposing your credit card information to hackers. Our Rachel DePompa shows you how to lock down your accounts in the simple step that adds an extra layer of protection in this week's Watching Your Wallet.
We all have pretty extensive digital footprints these days. That's the trail of data that comes from the websites you visit, the emails you send, the apps you download, and the social media accounts you create. Social media expert Marcy Thornhill says oftentimes your credit card number is tied to that digital footprint, and she says that is something you want to protect.
You're leaving a footprint every time you use your credit card, every time you log into an app to make a purchase or even browse. You'll notice sometimes that if you're saying something about Nike or a company, you may see a pop-up on Facebook. That's part of the digital recognition that it knows in advance what you're looking for.
Thornhill says go into your Google account settings and click on payments, and you will see every credit card you've ever used in history to make a purchase on that platform.
So if someone hacks your Google account, guess what? Now they have access to all those credit cards. Same thing with your Amazon purchases, subscriptions. Oftentimes subscriptions go through Amazon, but you'll see all those apps out there that you probably subscribed to years ago, you're no longer using, but they're wide open for hackers.
Thornhill says go into your accounts and apps and remove your credit card history if you can. She also says if your financial institution offers the option of using a virtual credit card or virtual debit card, set that up.
And that's it for us. Thanks for joining us here on Investigate TV Plus Weekend.